Hello and welcome to the program. I'm your host, Neil Howard. Thank you for joining us here on Health Professional Radio. You know, there's been an incredible surge, as some would say, in the methamphetamine overdose deaths, as a matter of fact, and especially in Ohio, the surge has been said to be as much as 130%. Our guest this morning is Dr. James Sturmi. He's an American Board of Addiction Medicine Fellow and Ohio Medical Director for Pinnacle Treatment Centers, and he's joining us on the program to talk about this. Welcome to the program, Dr. Sturmi.
Oh, thank you, and thank you for having me.
Well, I said that we were going to talk about methamphetamine surge and the surge in overdose deaths from methamphetamine, especially there in Ohio. Give us a brief background about what it is that you do and what you have done.
Yes, I'm a full-time addiction medicine specialist. I started with my company is Pinnacle Treatment Centers based out of Mount Laurel, New Jersey. And we have 28 facilities in Ohio, one inpatient and the rest are outpatient, either methadone or primarily buprenorphine or Suboxone clinics. And so I supervise all of those clinics and all of the providers that provide for them. And so I've been on the kind of the forefront of the opioid epidemic efforts. And we, during this process, particularly in the last year or so, have seen a massive surge in methamphetamine use among our patients.
What was it that drew you to addiction medicine?
Well, I have some personal experience from many, many, many years ago. So I definitely think that interest and personal experience has helped me build my energy and my desire to continue to make a difference. I had first 25 years of my practice, I was in sports medicine, and then as the epidemic began to grow, I saw more and more people that were struggling, and it just seemed like a good time to make a transition, and that's what got me going with that, and of course the flat out undeniable need for more providers.
Now, this surge in methamphetamine specifically, with all of the other things that are going on, you know, with the opioids, and what is it that's causing this surge in methamphetamine? And first, you know, our listeners are mainly healthcare professionals, but explain what methamphetamine is for those who may not be as familiar as others.
Methamphetamine is a stimulant. It is a potent medication. It actually is used in prescription form for attention deficit disorder. But on the street, it's readily available because it's very, very inexpensive, and that medication can be swallowed, snorted, smoked, or injected IV. And the effect that it has on the brain is profound. It causes a spike of dopamine in the brain that's actually higher than that achieved with injection of heroin.
Wow.
If you can believe that. And for that reason, even though it doesn't cause overdose deaths instantaneously as commonly occurs with opiates, it actually results in intense cravings and desire to use, because it just completely floods not just dopamine, but also epinephrine and norepinephrine as a pure stimulant. So it allows people, it gives a euphoria. It helps them escape from whatever feelings or situations they don't want to think about. And then it literally just pounds the brain. And when that stimulus is withdrawn, the cravings are very intense. And the reason it's become so prevalent is because many people who have been using and are addicted to opioids, either in oral prescription or heroin, which is obviously now commonly laced with fentanyl, which is even stronger. They see methamphetamine as safer in a strange and confused way, because it is certainly not safer. It may be safer as far as immediate, you're going to die when you use this today, but it is a very, very toxic and destructive drug.
In light of the opioid epidemic, it seems like you have this epidemic on both sides of the spectrum. Are the same factors that cause the opioid epidemic, aside from the pharmaceutical companies, causing this rise, this spike, and as some say, 130% in Ohio alone? Are we talking rural counties? Because we hear a lot about rural places that are being hit extremely hard by addiction in general.
Well, the forces are the same in that if you follow all of this back, the root of actually the drive to make these available is obviously financial. Mm-hmm. And for many years, especially in Ohio, most of the methamphetamine that was available on the street was produced in homegrown laboratories. It's got all kinds of toxic chemicals in it, and apparently it's very easy to make, but you have to have a space that where you can kind of get away with it because it's cooked. And for years and years in Ohio, these methamphetamine labs, like bootleg homemade labs, were blowing up, and they got some publicity, and then essentially the Ohio legislature passed a law that made it harder for people to do that because of the availability of the ingredients. And the Mexican cartel stepped in and decided that they were going to make it themselves. So what they now make, what's in Ohio at least, is almost all from Mexico, and it's made by the same Mexican cartels that turned poppy gum into heroin and smuggled it across the border. And so it's more pure, it's more potent, and it's readily available anywhere. It's not just from these labs in Ohio. In fact, there's been an 80% reduction in production of methamphetamine from the labs in Ohio as a result of that legislation that was passed a few years ago. So it's pure. It's inexpensive, and people that maybe in the past even were addicted to opiates will made a transition to methamphetamine because of that, the availability and the inexpensive aspect of it. It's pretty scary, actually.
Let's talk about this, the medication-assisted treatment, or MAT. You supervise many facilities that are committed to the treatment and the prevention of addiction, especially methamphetamine, opioid, alcohol, any of the addictions, chemical addictions. You say methadone for opioids. What's used for methamphetamine?
Well, unfortunately, right now, there are no FDA-approved medications for the prevention or treatment of methamphetamine use. I can tell you, though, it is a very, very high priority for the Department of Health and Human Services, the National Institutes of Drug Abuse, and the Centers for Disease Control in Atlanta. There are several well-designed studies that are currently underway, looking at different types of medications that might be able to help. I went to a conference in California here recently and got a review on that, and there is some promise with several different medications. For obvious reasons, I can't mention them now, but it is a priority, and I think we're making progress. It's just a very complicated drug. It affects the brain just so profoundly. I think we're doing the best we can for right now, and I think there's going to be a lot more ahead. But right now, I very much wish that we had a drug that would be effective against methamphetamine addiction, but we don't. And I will tell you this: the stats that you quoted are. I think it's higher than 130%. In fact, I'm almost sure that it is. I know that nationwide, at least in the last, I believe, 3 or 4 years, it's at least 500%.
Oh my goodness!
So it's a scourge. In fact, many people are referring to it as the fourth epidemic. The first one was prescription opioids, then there was Viva converted it to heroin because of the lack of availability of prescription opioids. Then the fentanyl replaced the heroin, which is just even more deadly. And now we're starting to consider this methamphetamine surge as the fourth epidemic, and it's tragic because it's killing people, and it's one of those medications that can make people psychotic. And I think I'm seeing many people who I believe can't prove it yet, but I believe there's some permanent brain injury, or at least irreversible brain injury that is very, very challenging from a behavior and
even
mental health change.
Even if they seek treatment and are in recovery, there are things that just can't be undone as they can be undone with, say, alcohol, cocaine, heroin, opioids. Is that what you can't prove yet, but you have a very, very strong feeling that is in fact the case? Absolutely.
And it's a real conundrum because we don't. How do we prevent that? How do we treat that? What meds should we use to even try? Where's the point where it becomes irreversible? It is such an incredibly toxic and potent drug. And I mean, it's made with all kinds of solvents and, things you clean homes with. It's really nasty stuff. And we just don't know what the long-term effects are. But just from my experience and this is thousands of patients overall by now, that at least that I'm responsible for it. The stories just keep coming, and they're just getting harder and harder to treat. And they get psychotic. Many of they may get an irreversible psychosis if they smoke or shoot enough meth. They're up for days or weeks at a time, and their brains just really dysfunctional and tragic.
Well, Dr. Sturmi, give our listeners a website where we can get more information about your facility, your network, and learn a little bit more about meth and how we can become involved in its prevention and treatment.
Our website is pinnacletreatmentcenters.com. There's a lot of availability of information on there, and I think that's probably the best link. There are other resources available. The Centers for Disease Control and the Substance Abuse and Mental Health Services Administration are also both very, very good resources.
Hey, thank you so much for taking the time this morning.
Thank you, Neil. Have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. James Sturmi. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.